lunaku. Yes, sebo.
Excellent. So katugenda kugera ku back pain. Yeah, we're going to talk about back pain, and of course we're going to be exploring what back pain is, and of course who's at a risk of getting back pain, and how can we prevent back pain, since it is a common condition. But importantly is that we shall also be exploring the causes, the prevention, and of course a few treatment modalities available here in Uganda. And later, of course, we shall also explore knee pain, and of course see how it goes around. Of course, back pain and knee pain, all what joint pains maybe you can say so, but we shall be giving more emphasis on back and knee pain. So, Dr. Fahad, please, Dr. Kavuma, please try to master what is back pain, knee pain, cutting through. And then we go ahead and talk about what causes both of the pain.
Yeah, I think the general term to put them all together is joint pain.
Please,
joint pain. Joint pain is a broader term that involves a lot of things. Maybe to be specific, it could be back pain, it could be knee joint pain, any joint on the body, ankle joint, shoulder joint, and so on. However, it's a complex. It involves very many things that pain. It's a general symptom because depending on what joint we are talking about, there are various structures that make up that different joint. For example, if we go to the back pain that most people complain of, it's the back is made up of these vertebral bones, and of course we all know the spinal cord and nerves all pass through those backbones. So this pain at times, especially if we look at back pain, can be caused by various cases. The major one of late is degenerative, but we can have mechanical back pain, we can have traumatic back pain, and some others. But I'll maybe to expound more on what we call degenerative, because it's what most people mainly complain of, especially our elders, people above 45 years, the females, and also the males. Degenerative means it comes slowly. This pain that comes as maybe someone ages due to various risk factors. For example, we can have issues to do with obesity. We can have issues to do with the type of work this person has been doing in their youthful ages. People who do heavy work, lift heavy loads, and others have maybe any other histories of maybe getting injuries. Someone will come to you and say, I got a fall around 10 years back. Naye kati omugongo tusekata kati gunnuma nombuuza wafunako kabenje iti nabwako kabenje motoka n'enkuba emyaka nga 10 mabega, but the pain comes eventually. So the degenerative causes of pain zibeerawo nga pain tezerwa kuba tetandise yokka naye ezempola mpola nga accumulating until someone says, I think I need to maybe visit a doctor or I need to do something else. Then you have another back pain that comes as maybe mechanical. Someone is moving and they are hit by something. Maybe these are young children, adults, maybe 20 plus. You're walking and something hits you, or they get involved in an accident and they report to this facility with back pain and so on. So it is very complex that it shows pain or is a symptom that there is something going wrong. Especially for this case now, it is the nerves that are being involved, either the nerves or the muscles or the ligaments that are in these specific joints. For example, in the back joint, we have the spinal cord nerves that are moving through. We have the ligaments that make up the the vertebral joints, and also we have the vertebral bones themselves. So as maybe space, what we call disc space, decreases in these joints, they try to, the bones or the vertebral bones irritate these nerves that are passing through these bones, and that causes this pain. And that pain, most of the times, for example, the back pain, you will find it radiating to these other body parts. Someone tells you, it will cause that pain that is radiating, starting from at whatever level of the back the specific condition is. If it is maybe lumbar spondylosis, if it is maybe PID is a prolapsed vertebral disc, the space in between the vertebral bones is decreased. Or if it's lumbar spondylosis that is degenerative, the space is decreased and also you are forming some osteophytes and so on. So the patient will complain of back pain, they will complain of numbness ambulance is mu Luganda ndowooza kusanyalala yajja kugamba amagulu omugongo manene amagulu gasanyalala and so on and so forth. Even other symptoms for others, the elder will complain of maybe they can no longer hold their maybe urine nagamba mpulira mfukira kumusobola kukwata musulo because these nerves that innervate these other organs of the body down and below all originate from the back. So back pain, don't take it lightly. It is a signal of maybe something is going wrong in between the innervation or if not the bones themselves. Then this other pain, for example, the knee joint pain, like we want to explore more, very many people are reporting to these facilities with their complaints of knee joint pain. It's a complex thing. If you look at our knee joint, msao kamara, it's made up of these two bones, the major bones, the femur, the tibia. Amagumba gakole vivi lyafe. We also have other and also gumba lyo mu kisambi ne gumba lyo ku kigere abantu bakiyita kigere. Of course, but it's femur, tibia for those who are good in English and so on. Yeah, but still on our joint we have very many things. We have the menisci. These menisci act as cushions for this joint. We have bursae around that joint, and most importantly, we have ligaments around the joints. So, when someone reports with knee joint pain, it's our role as maybe the medics and the skilled people in that sector to find out what exactly of the structures in the joint has a problem. At times, if it is the bone, the patient might report saying, I was moving, then I was knocked down by boda, then I feel this knee joint pain. My joint is swelling and so on. So we capture that. Maybe to be more specific on the causes of these joints, of course, even in the knee joint, you have degenerative causes where someone will report with histories of maybe if they're youths, they may report with a history of an injury, maybe a sports injury. We're playing football around 2 weeks back. Someone knocked me, then, but now I'm feeling pain in my knee. Others, they will report with maybe they got a fracture in the joint that healed sometime, but now they're reporting with pain after even the fracture has healed. Other times, we have people reporting with maybe they can be ligamentous injuries. The ligaments, you have very many ligaments on this knee joint. You have the anterior cruciates, posterior cruciates. There's so many ligaments. If they're damaged, weakened, or in case there is anything to do with those ligaments, they still too can cause this pain. If it is a meniscal tear, someone was playing and maybe they fall into a ditch and the knee joint is forced into extension, or if someone is doing some good mechanical work or they're doing heavy work and the knee joint is compressed, any force to this joint is can cause that tear. But as well, for the degenerative part of it, the most common one is osteoarthritis that brings these patients to the...
What about osteoarthritis?
Osteoarthritis is a degenerative condition, chronic actually, a degenerative condition that involves inflammation at this joint and also formation of osteophytes. It's a mulufuti nti someone will report saying my knee is paining. I can't bear weight on this knee sometimes. It swells and I have stiffness that does not last maybe 30 minutes. It's always less than 30 minutes. And it's caused by wear and tear. This is what we call wear and tear. Like I explained to you, our joint has what we call cartilage that cover these bones, the long bones. So like any other, maybe if you have a car, whenever you move with your car for 5 years, you find that the tires are wearing, you get? So even our joints at times tend to wear, maybe be due to the most causative risk factor these days is obesity. People having that much weight that is deposited onto these bones. But other times you can even have things to do with diet, but also even family may cause, genetics can cause a factor here and there, but even these post-traumatic histories, like someone having a history of a fall, maybe an injury to the ligament some time back, maybe someone says, I got such and such an injury, but that was time back. So eventually, the space in between our joints reduces as our cartilages are wearing off. So when they wear off, they start to become inflamed. The bones start crashing and it causes inflammation. And that inflammation will cause the pain as foreign bodies in the joint and identified as foreign bodies. So the body is reacting to those foreign bodies, which are just broken pieces of maybe the cartilage and so on that is in this joint. So the patient will report with pain. They normally come with swelling. They normally come with difficulty in moving. Some may even limp. And once not attended to, other times even the joint may become locked because the cartilage is off and these bones are now being hooked up and they are locking. So that is osteoarthritis. For it comes with time. We have primary and secondary. Primary may come due to naturally someone is aging, especially if you look at the statistics show us these ladies who are 58 years and above, they normally come with that pain in the knee because if you look at their hormones, at that time they are in menopause and the estrogen levels are low, yet estrogen is very good in maintaining our the cartilages or the the cushions of our bones inside there. So they normally, it's actually ladies that report most with that osteoarthritis because of the hormonal changes that are taking place after menopause. But to take you through maybe osteoarthritis, how we can how you can manage it.
Can osteoarthritis happen to which joints does
Osteoarthritis happens to all these joints, the major joints of our body. It can happen at the hip joint, this femur, plus the acetabulum. It can happen at the knee joint. It can happen at the ankle joint. It can happen at the shoulder joint. Very rare on the elbow, but especially these joints, the knee joint, hip joint, and the shoulder joint.
Excellent. Thank you so much, Mr. Fahad Kavuma, and of course for elaborating with us about what osteoarthritis is, but also looking at both back and knee joint pains are most common. And of course, you're still watching Better Vision Health and Beauty program live here at Makerere Gospel Church. And of course, this is where your health begins from. We create awareness so that you can prevent these conditions from happening to your life, so that you can remain productive to your community and keep some monies without running to hospitals. And now we are still talking about osteoarthritis. But before we run to that, could you please take us through a few statistics about the back pain, maybe the knee joint? In the 10 people whom you meet at your clinic, how many people are suffering this condition? You as an expert.
Actually, the statistics are showing, especially for, I'll start with the knee joint, around 7 out of the 10 youths that come to the orthopedic, the young people and old, most especially adults, around 7 to out of 10 that report to orthopedic clinics specifically will come with issues to do with joint pain. And even the statistics are showing us that with time, actually by 2050, they're estimating the number might even go to around 9 out of 10 due to these risk factors that are increasing, the nature of how people are living their lives, the obesity is increasing, the people even the feeding also is also changing. So the statistics are showing that around 7 out of 10 of people report to the orthopedic clinic normally come with this knee joint pain of whatever kind. It could be traumatic, it could be osteoarthritis, it can be septic arthritis, those who come with fevers. Every knee joint pain is not osteoarthritis. We have septic arthritis, we have rheumatoid arthritis, where the body is identifying the joints as foreign bodies, the cartilage at the joints as foreign bodies, and they begin self-attack. It's a very bad condition also. It's a very bad form of osteoarthritis. Normally it starts with the small joints in the small, and for it, rheumatoid arthritis attacks very many joints, or what you call polyarthritis. Someone is complaining of the knee joint pain, with back pain, with shoulder pain, with ankle pains. So almost all the joints are having aches or pain. We also have gout arthritis. These people are people who enjoy eating a lot of meat and so on, the white meat. We have maybe high concentrations of uric acid, and at times we get them having gout arthritis in their long run. So it's very, even in the young children, they have what you call juvenile arthritis. So it is a lot. That's why we are saying around 7 out of the 10 people normally report with this kind of pain. If you go to the back pain, for the adults, it's normally around the ladies, most especially 60 to 70%. You see very old ladies of around 45 years and above that are reporting with this back pain due to the nature of the work they were doing and also on. Remember, our ladies are so much involved in cleaning the house, they are stretching. There's others in the village are digging a lot, they are kneeling and so on, and all these ones have impact on the joints. For example, we usually say that every kilo you add on your body weight, the knee joints actually feel 3 to 4 kilos. And whenever you lose 5, maybe if you lose like 5 kilograms, Dr. Kamara, you don't know what weight you have offloaded off these joints. So why we are saying obesity and increased weight has been a very is a prevailing risk factor to these back pains and the knee pains. But for the back pain specifically, the statistics show us that mostly it's women that are reporting to these facilities, and elderly women or even men around 50 plus. For the young children or adults that are below 25, the normal reports may be due to traumatic back pains. Someone has lifted something that is very heavy, they have been involved in an accident, and so on. But at our facility or in the clinics, we normally receive these old women that are crying of back pain, crying of numbness, burning sensations, and so on and so forth.
Excellent. Now, of course, before we go for a short quick break, we want us to discuss about the young people. Of recent, we've seen many young people complaining of the back. What is the special in the new trends about the young people?
The special thing in the new trends about young people, one, I've mentioned the first one. You realize that very many young people now are becoming obese. The BMIs are increasing every now and then because of the junk foods we are eating, the nature of life we are living, lifestyle we are living. We are not doing enough physical exercises, and so on and so forth. But as well, the major cause of that back pain in the young people solely lies in lifestyle. If you look at how these people are running their lives, the way the chairs they're sitting in office, at work, those who are working, they are not well lined to the way how the spine bones should. They have a normal curve of the spine that should be followed when someone is either even sitting or even asleep. Even when you're asleep, there is a normal curve of the neck spine that we should be maintained, the inwards and the outwards. So people are having those abnormal postures. Someone is sitting for long hours and they are in an abnormal posture. Of course, others are living a lifestyle where it involves others, maybe the minority or the majority are doing heavy work. Someone is 24, they start working at the age of like 15, they are carrying heavy loads in Chikubo. They are digging for almost 10 hours and so on. All that weight is transferred back to these joints of ours or to these bones of ours. And in due course, you'll have these back pains coming in here and there. But of course, I wouldn't like to miss out another cause of back pain, especially in these young adults. Normally, they tend to misdiagnose it as a back pain due to maybe bones and so on. Yet, indeed, we are dealing with urinary tract infections. There are some...
So there are some differentials. Please take us through them. Some of the differential diagnoses.
Some of the differential diagnoses.
Misdiagnosis.
Yes, because at times even some of our colleagues may miss them out. Someone complains of back pain and your conscious takes you direct to the bones. There are some differentials of the back pain. Back pain, I said, is just a symptom. Someone might have what we call pelvic inflammatory disease, PID. They all present with the back pain. People who have cystitis, that is, those are urinary tract infections of the upper urinary tract. Chronic ones can present with what? With back pain. People even are having, sometimes it can even be abdominal pain that radiates to the back. Someone has maybe some problems with maybe the internal organs and so on. So always back pain can be, the differentials could be maybe pelvic inflammatory disease. We can have issues to do with urinary tract infections. We can have issues to do with our ladies here, someone may be having an ectopic pregnancy. Yes, if someone may be having an ectopic pregnancy and they present with this with this back pain and so on and so forth. So it's always very many investigations and clinical examinations that we do to rule out maybe what's causing this exact back pain.
Thank you so much, Mr. Kavuma. Dear viewers, you're still watching Health and Beauty program. That's why you're hearing very new words that some are hard, others cannot be googled, others are from an expert. We'll go for a short quick break, but we'll return to discuss more the prevention and treatment strategies available for the back and the knee joint pains here.
Good Day TV, transforming your life.
In the neighborhood, near stagnant water and mosquito breeding sites, malaria lurks, always waiting to strike. But fear not, for here comes Mr. Vaxa, the ultimate protector against malaria. For years, malaria has been one of the biggest threats to children under 5, making them weak and even putting their lives at risk. But now, the government is introducing a new solution, the malaria vaccine. The malaria vaccine is now in the routine immunization schedule. The malaria vaccine is administered in 4 doses at 6 months, 7 months, 8 months, and 18 months. This vaccine will provide extra protection against severe malaria. And don't forget, routine immunization protects children from many deadly diseases. Every vaccine matters. Visit the nearest health facility for routine immunization services today. Mr. Vaxa, the malaria vaccine is free, safe, and ready to protect our children. Will you join the fight and complete all 4 doses? For more information, call the Ministry of Health on 0800-100-066. This message is brought to you by the Ministry of Health.
Wayagala ebyuma ebirungi ebyogera basita pasiteri atunda nange ngoma nekita zonna basita pasiteri amplifier nemizindalo basita pasiteri ebitala bya siteji ebyebika byonna basita pasiteri ebyuma bya ivetisi tubirina byonna basita pasiteri awutudo wa screen tupangisa basita pasiteri kukizimbe kya Newmarket William Street basita pasiteri katindo kendayo musajja mwesigwa kitufu endo gye gisoboka ekibanja mpona akikwata wagulebye ekkanisa jangu ewa pasita pasiteri
tusangibwa ku kizimbe kya Newmark ku William Street ku ground floor room number N31 opposite DFCU Bank. Esimu noti 772200 ne noti 752200 wano wokka we tusangibwa.
Good Day TV, transforming your life.
Once again, I want to welcome you from our short quick break. Once again, this is Health and Beauty program with me, Kamara Daniel, here at Good Day Television live at Makerere Gospel Church at Aprokagwa Road in Kampala. I want to appreciate you for loving us and for being here all the time and for prioritizing health and beauty. For our viewers watching us all over the country, I want to appreciate you and for your messages, always encouraging, and for your questions. We've always answered them. Just what you do, you go to our social media platforms, Good Television, LinkedIn, Twitter, YouTube, TikTok, and then put your question. And of course, we shall get the questions and then answer you back once you put them there. Just like we're still talking about back pain and knee joint pains, but we want to explore what are some of the treatments. You want to begin with treatment or prevention?
They already say prevention is better than cure.
Because 75% of health conditions in Uganda are preventable.
Yeah.
So now let's begin with prevention, wide spectrum prevention.
Yeah.
Ranging in different spheres so that people can have a spectrum of management so that we can prevent these health challenges in our society.
Yeah, yes, of course, most of the causes of this back pain and knee joint pain, most of them are preventable. Although some may not be preventable, like aging and so on. You may not prevent yourself to age and maybe get issues. But I'll start with basically the general one. Like those who have been following us, the first one that we need to do, one, we need to maintain a good body weight. Because every kilogram you add, we're adding extra 4 kilograms of force onto these joints, especially the weight-bearing joints. That is the knee joint, the hip joint, and so on. So keep in balance of your weight so that we don't put the bodies or the joints at a risk of bearing this too much weight that can cause this pain and so on. Secondly, I'll move on to the diet. We should have a good balanced diet that is rich in good supplements that maintain or keep our joints in a good working condition. For example, in your diet include vegetables and maybe fruits which contain these minerals that will keep the joints well and also supplement them very well, so that you don't end up getting supplements because of the joint pains and so on. I'll move to the other way that we can prevent these joint pains, the back and knee joint pain. We treat these injuries immediately when they come. When you get an injury, maybe to the knee joint or hip joint, don't wait for so long before going for treatment or or visiting health center for management. At times people get involved in accidents, or they get trauma and someone sits back and waits, or they don't manage it well. In the due course, like I explained in osteoarthritis, when you have histories of traumatic pain, when you didn't manage it well, it will come out very well. It will come out eventually. But if you manage the injuries, the joint injuries accurately and in time, we at times prevent this pain from coming and reoccurring. The other thing that we should do in how to prevent still these joint pains, the nature of work that we people are doing. If you know that your nature of work involves lifting or carrying heavy loads, especially on the back, on the head, my brothers out there, my mothers out there, please let us regulate the back, the nature of work we're doing. This is your job. I understand you're supposed to carry a sack weighing over 100 kilograms and you're supposed to carry over 100 of them to the truck. Have resting time, and have resting time between these while doing your work. In case you're carrying like 100, don't carry 100 at the same time. Please carry few, allow your back to rest, then carry the other. In case you're doing any other work, even if it is these people of us who are working in offices, the secretaries and so on, they are normally coming to us and reporting back pain because you arrive at work at 8 and you sit in that given position up to around 5 p.m. without moving, without exercising. So we normally tell this people, change lifestyle modification. If you're having an office, create some space in the office. People are even now doing physical exercise in their offices. When you get some free time, 2 to 3, 5 minutes, stretch. Please stretch a bit. Relax these joints so that the weight is offloaded off these joints. Then in the due course, the joints will relax. Then you repeat the nature of work what you're doing. And if you find out that you're getting back pain, please visit the qualified people to look at the back pain. They would advise you maybe on the nature of the posture you're sitting in. They would advise if they have, because they have some, I'll explain in the treatment, we have things like braces that normally give to these people who are having issues of that offload some weight from these from these joints. But we shall discuss that maybe when you're discussing the treatment. So generally physical exercises, diet, weight, treating these joint injuries immediately they come in, and also maintaining a very good lifestyle of maybe how you moderate what you eat and the nature of the kind of work that you do. I would say those are some general ways how we can prevent, and of course having these regular checkups so that they identify what's the exact cause of pain. Don't sit there and you think your back pain is caused by maybe bones and you miss out on others. Like I've explained, you may have an ectopic pregnancy, it may be UTI, and you're not in the know of what exactly is causing the back pain. So to prevent it from escalating or becoming further, always reach out to the facilities or the medical facilities so they can guide you on what exactly is causing these joint pains and what needs to be done at that particular moment. Yes.
Wow. Thank you so much. You talked about prevention, but now we'll talk about the use of supplements as a mode of prevention, and also the use of herbal drugs. What comments do you have about them?
I will start with the supplements. They have become so common of late. People are using a lot of supplements in terms of maybe the pains. They're taking in very many drinks, beverages that are having supplements. When someone is watching what they're eating, they're having a good balanced diet, they're eating the fruits and vegetables. And when someone has no known illness that is causing maybe reduction or deficiency of specific nutrients that are responsible for our bones, maybe the calcium and so on. Once you don't have any deficiency. Maybe once you have not clocked menopause, you're a lady, you have not clocked menopause, you're a man, we don't expect you to have, if doctors have not said you have deficiency, please eat the natural supplements that are in the foods that we take, that are in the greens that we take and so on. We normally, the supplements, the studies show us, for example, if you look at the knee joint pain, the supplements literally have less effects because some are not guided and they don't give the correct amounts of what maybe this person may need, and at times you have excess of them, or if not, they are unnecessary. For example, when we shall look at it in the management of these joint pains, where we have some of these drugs that we give that have those supplements like glucosamine and so on, others that help in regeneration of these joints and so on. So about these other supplements that maybe someone can just pick here and take, please take them under caution, or when they are guided by a medical person. If they have told you, they have run tests, because the tests we can run, electrolytes and so on, we find out that really this person has deficiency of maybe calcium or anything, so that we can initiate these supplements. For the herbal medicine, that one I would say always, I wouldn't say we rule them out, but what we can do, or is herbal medicine also should be guided by.
So encourage the use of herbal medicine?
No. That's why I said I wouldn't encourage them, because, for example, in the back pain, I don't know which kind of herbal medicine you're going to take. Or if the knee joint pain, are you going to get Mzigo Muganda and you massage around?
What's the Mzigo Muganda?
I think it is ghee. You know ghee? Okay. Yeah, but is this specific affair of ours, of the joint pains that we're talking about today, we have not had so many issues of the herbal medicine, but we have had people selling their drugs that they say do this and this, but when they are not into the book. So I always advise you visit a medical and a qualified person to take you through on what drugs you should take and what medicine should be taken for this joint pain. Don't just pick anything and take. It may have effects at the end of the day.
Thank you so much, Mr. Fahad. Now, of course, let's look into treatment in a way of simplifying this, because viewers don't know what drugs are available. Just give us the available treatment modalities. There are surgery, and there are oral tablets given, and for each condition, and how long is this treatment? Can the problem go away completely? I have to refill my medication, and how long can I live with such condition as you come to completion?
The most standard definitive treatment modality that we should look at is lifestyle modification, that I've expounded more in the other, like I've said, the weight, exercises and so on, these repeated exercises that can take away that pain. But of course, once the pain is persistent and you have maybe at times you have been diagnosed with any of these causes of the joint pains, if it is maybe osteoarthritis, if it is rheumatoid arthritis, if it is lumbar spondylosis and so on, we normally go for the conservative management at first. Conservative means we are not doing surgery at first, and conservative, the non-pharmacological. The non-pharmacological means you are not taking any drug, you are just changing the lifestyle, like I've mentioned. But once, on addition of that, or at times when it fails, we switch to, actually in the non-pharmacological, I've not mentioned things to do with physiotherapy. Physiotherapy is also key in management of these joint pains. They have regulated exercises and specific exercises that we, the physiotherapists that we work closely in touch with, do to make sure the person is relieved of that pain. Secondly, we have assistive devices, or what we call orthotics, that you have seen people are wearing these braces. Muluganda mbita bisipi, ayambadde chipi mugongo, ayambadde choku vivi. These braces are designed in a way that they help offload weight from these joints. They have metals in between. For example, if you look at the lumbar corset or the chipi chomogo, and those metals help to offload weight from the back. The way that would have come from the head and so on the trunk to the stake to the vertebral bones is offloaded by these braces, and also to maintain a correct posture of this person so that they do not compress these bones. Remember, if people having, for example, back pain, you find them sitting in a given position because it gives them comfort. They can no longer sit straight, and so on and so forth. So we normally give them those braces to help them keep the bones in a given position and also offload the weight and so on. So still, I've mentioned the braces, I've mentioned physiotherapy, I've mentioned lifestyle modifications. That is the conservative. So by the time we chip in with these drugs, we give just drugs to one, regenerate the joints maybe, and also take away the pain as well. So those are the two treatment modalities that are in the conservative. But in the later stages, when maybe the joint has fused now, or in certain grades of maybe if it is osteoarthritis of the knee, we opt to do surgeries, and those are guided, like arthroplasty. At times we aim at doing a total knee replacement. So at times when it is too much, and the lifestyle modification plus the drugs, even these sometimes we have what we call intra-articular drugs, the steroids that we inject into these joints, for example, in osteoarthritis and so on. If they have really failed and the joint is sick, at times we go for surgery and we give you a new joint. You get a new joint. That is the surgical part of it. Other times, if you have a fluid accumulation in cases of the knee joint pain that maybe is arthritis, either septic, or if it is arthritis, if it is bursitis, we normally do what we call aspiration. We take away this fluid that has collected in the joint. Then we give drugs depending on what is the cause of the accumulation of fluid. If it is septic arthritis and maybe it is a bacterial infection, we give the specific antibiotics that are needed. If it is osteoarthritis, still we monitor and give these other intra-articulars that are needed to take away that pain and manage. So the treatment in brief contains the conservative that I've discussed and the surgical part of it that normally comes at the end. It's rare for us to start with the surgical, so we normally do conservative, but major take home is lifestyle modification under conservative. Watch weight, watch the nature of work you're doing, and also report and treat injuries the way they come immediately.
Excellent remarks. And of course, we've learned a lot from you.
Yeah.
We've learned a lot how it comes about, the causes, the risk factors, and a few statistics that indicate the problem where it lies, so that we can pay attention to what we are studying. You know, when there's no problem magnitude or the magnitude of the issue at hand, people usually say, we are still safe, we are still safe.
Yeah.
Until you say, please, in 10 Ugandans, 7 you say report the problem of back or knee joint, and like, hey, can I be a culprit? Now, before we end this program, we want to call different communities. We want to call the public, we want to call on the government, we want to call on the people who employ us. You talked about people who carry heavy loads, remember making some money without working at it, and we want to ensure that different jobs favor us because we have different job descriptions. Let's first call upon the community that's watching us on Google Television today. What's your call to them and also advice about? Then that you can call on the health workers also to properly organize this condition and do not miss it out. Or else they can refer to the specialists.
Yes, to the community, one, we need to be very vigilant of our bodies. Any pain that you feel, don't take it slightly. At times, people just get small falls and someone says, it's a small one, I'll take care of it. I massage, I put some hot water and so on. And eventually it turns out a person had a ligament injury. They put some herbs. And this is a person who has got a ligament injury. Someone has got an intra-articular fracture, but they're taking it slightly. So whenever you see pain, please visit the necessary people those are the medics or the basao how you call them, so that they can know what exactly has gone wrong. So public, be very vigilant and follow what your doctors or the basao are telling you. If it is about the nature of work you're doing, if it is about your weight, if it is about the kind of food you're eating, if it's about your posture. Yes, that takes me to the workplace. These people that employ us, me and you plus the rest, please, before you procure what the seats, maybe I'll start with the seats of how your clients are going to sit, how your staff are going to sit. Can you put into consideration what kind of chairs you're bringing? Because there are chairs that do not follow the normal curve. And when someone sits on it, they normally stand up and get the back pains eventually. So you should follow. They are what we call specific orthopedic chairs for given conditions that are good, that have the normal coverage, and they are available on the market. You go out there, source them out, and you can buy them. You people, for example, I forgot to mention about the public, how you sleep. At times, even the posture and the nature of mattress you're sleeping on. People are reporting with back pain, and you still sleep on mattresses that are soft and so on. Actually, technology has advanced. We have what even we call orthopedic mattresses. They're available in the market. I will not mention brands here. They're not sponsoring us, but they're available in the market. And these ones are made specifically, why we call them orthopedic, people having back pains and so on. You try those kind of mattresses. There are pillows that we put. If you're traveling, if you're sleeping, there are pillows that have that normal curvature of the neck, and they can support so that you don't wake up with those neck pains and so on. Then I would say to the health workers, please let us talk to these patients. Please clerk the patients very well. Let them tell you every history that they have, so that you can make a clear diagnosis. And in case you feel you're not in the capacity of diagnosing, if you do your part and you think you're not in the capacity, we have people who are specialized. The orthopedic officers are there, the orthopedic surgeons are there, if the medical officers are there. So you go ahead and refer to those people who can deal specifically with the issues to do with the bones and the muscles and so on. To the government, you asked me to make a call to the government. To the government, I would say one, especially about the orthopedics part of it, that's where we're having the back pain and the knee joint pain, to avail the necessary machinery that is required to diagnose some of these things. There's no way Nzao Kamara we shall diagnose your ligament injury without us doing an MRI, without us doing a CT scan, without us doing an ultrasound scan. And many of these facilities do not have that. There's no way we're going to diagnose an intratitular fracture or lumbar spondylosis without us doing an X-ray. So you find that very many districts are lacking this machinery, the X-rays. People have to travel. Other times, the medics or the health workers are treating it in suspense. You just report with symptoms, they think maybe I'm handling this. At times, they're handling very different. So as long as the machinery are there, the X-rays are there, the MRIs, the costs are lowered because maybe they are around, the CT scans and so on. Plus, the available, the needed manpower. Yes, if it is orthopedic officers, maybe at the district hospitals, regional referrals and so on, physiotherapists, orthopedic technologists, and so on and so forth. They can just enrich and staff those people that are required in this specific field of dealing with the bones and dealing with the muscles, so that that's orthopedics and so on. And lastly, maybe government can just create awareness also. Government has the capacity of creating awareness about this specific, even the nature of workers. They regulate these people, employers. They can put minimum standards of how the environments at the workplaces should look like. What kind of chairs are they having? Do they engage in physical activities? These companies are now, I've seen some institutions are trying them out. They're making people do physical exercises at the company itself. Maybe 2 times in a week, they bring in these the gym people or the physiotherapists. They make people do these exercises so that they maintain a good weight, so that they maintain good physical activity, and so on and so forth. Even looking at these other regulators so that people do not do this extra work that is very heavy. We have brought machines, so heavy loads. Please, at the sites where you're working from, your engineering and so on, you can use machines to do the heavy work so that these people are doing the technical work or the light work that is not so heavy onto their bodies, as well as having medical insurance is very key. So that's what I can call upon the government to do. Yes.
Thank you so much. You've shared lots of information. I've just been learning. That's why I paid a lot of attention, and I am a good student, by the way.
Thank you. You are.
The information that you shared here. And of course, we believe our viewers have learned a lot about bone health, to ensure that your joints are taken care of. Given your expertise and the information that you've given us here, we are sure that people have learned a lot and have gained an insight about how joint health should be maintained. But also, you've called upon the public to make sure that the use of supplements, ensuring that they are taken consent of before they are used. It's very, very important. And I want to thank you for your expertise.
You're welcome.
For coming to Greater Vision Health and Beauty to share with us about joint health. And of course, this is Health and Beauty program. Friends, we are streamed live on YouTube, Facebook, Twitter, LinkedIn. You can find all this running and post your question, comment, suggestion about this. And of course, as we intend to leave this program here. We want to urge you to always watch us every Wednesday, 8 to 9 p.m. I'm Kamara Daniel. I hope to see you next Wednesday. Take care of yourself. Self-care is the only important thing they can tell you tonight, so that you can know your life and love it so much. Importantly is that there is also a snack campaign. Make sure that what you eat is your responsibility. I am Kamara. See you next Wednesday. Bye-bye.